Only on CBS Atlanta, how many times do you wake up at night because the person sleeping next to you is sawing logs? Of course, snoring can be annoying for your bed partner, but it can also be a sign of something much more serious. In tonight's Health Alert, Stephanie Fisher tells us how to stop snoring and when it might be time to wake up and see a doctor.
Marvin and Penny Shefsky have shared a bed for nearly 40 years. But recently, something came between them.
It is between him and the dog. I'm not sure which one's snoring, but yes, when I do wake up, he does snore.
About half of the adult population snores during sleep. It can be embarrassing for the person who snores and disruptive to the person beside them. And the odds are your bedmate snores.
The airway is supported by muscles, and while you sleep at night, the muscles relax. And as you pass air past the relaxed muscles, they can move. And the movement causes a vibration that you hear as snoring.
Dr. Jeffrey Durmer, co-founder of Fusion Sleep, says snoring itself is generally not harmful, but it can be a sign of something serious. And it was for Marvin.
Exhausted. All the time.
For years, the 65-year-old battled extreme fatigue during the day, and then at night, he not only snored, but oftentimes woke up gasping for air.
It's not a pleasant feeling. It didn't really set off any alarm bells because I was still waking up breathing.
It did alarm Penny. She urged him to go in for a sleep study. And good thing he did, because Dr. Durmer diagnosed Marvin with obstructive sleep apnea.
The upper airway itself, when you relax it, can actually cause a serious medical condition called sleep apnea. And that's when the airway sucks itself closed or nearly closed.
About 75% of people who snore have sleep apnea. And if untreated, it increases the risk of hypertension, stroke, and heart failure.
I was glad we found a problem. I was glad we addressed it. And I'm very, very glad that there's a solution to it.
The most effective solution for sleep apnea is the CPAP mask. CPAP, by the way, stands for Continuous Positive Airway Pressure. It increases air pressure in your throat so the airway doesn't collapse when you breathe in. Another option is an oral appliance. It's more compact, but less effective.
So you can actually extend the jaw just slightly, and it holds the back of the airway open.
Both therapies are helping Marvin sleep soundly these days, and he says life is better. And Penny agrees.
I don't fall asleep in front of people anymore. And
Actually more pleasant, which is nice.
I can change that.
If sleep apnea isn't the cause of your snoring, there are a few simple things you can try. If you're congested, take a decongestant or use a nasal saline spray before you go to bed. Also, sleeping on your back can make it worse, so lay on your side instead. And snoring can be linked to excess body weight, so if you need to lose a few pounds, it may help and the snoring may stop. To learn more about snoring and treatment options, go to cbsatlanta.com and click on Health. I'm Stephanie Fisher, CBS Atlanta News.